Are you struggling to understand your Epstein-Barr virus labs? They can be really confusing with all the different markers. I'm Dr. Casey Holland, naturopathic physician, and today I'm going to talk about the 5 labs that you want to make sure that you're checking if you're trying to understand if Epstein-Barr virus is something contributing to your fatigue and chronic symptoms. As a naturopathic physician, I spend time addressing patients in a holistic modality, and labs are no different. They only tell a piece of the story, and we need to look at the whole picture. In this episode, we'll be looking at labs, understanding them, and how to continue viewing them. On this channel, we discuss chronic infections, things like Epstein-Barr virus, Lyme, mold illness, and other complex chronic illness that oftentimes can be very confusing and difficult to go through. All right, so let's talk about Epstein-Barr virus. If you don't already know this, it's a virus that's from the herpes family of viruses, which means that it is incredibly common, and it is estimated that over 95% of people have been infected with Epstein-Barr virus. But obviously there's not 95% of people dealing with fatigue and other symptoms that it can cause. So the question is it a problem for you, and how do we know that? Oftentimes, patients will get tested for mono, and that is the first time that someone presents with Epstein-Barr virus. Epstein-Barr virus is commonly known as mononucleosis, and oftentimes this is the first time that you've ever heard of it. Usually this happens in childhood, middle school, high school, sometimes college, but this is generally the first time that somebody is exposed to the virus and gets sick. Now, the tricky part here is you might not ever have even known that you had mono. It can be very mild. It might have been mistaken as the flu, so you might not ever know that you had it. With this virus, it's considered an opportunistic infection, which means that typically after you have it once, your body should be able to recognize it, address it with your immune system, and keep it in inactive or a latent state where it doesn't cause any problems. But what we see happen is that it will go back into an active state where it is actively replicating and causing symptoms. And this is what we're talking about with Epstein-Barr virus reactivation. So let's first talk about how we test for mono, or the first time that you would be exposed, infected with Epstein-Barr virus. That test is called an IgM test. It will look on your lab panel as VCA, viral capsid antigen. So VCA stands for the response to the exterior capsule of the virus. So VCA IgM is what you're going to see for that first panel. And oftentimes I still see if somebody is being tested and later on in life, labs might just run that viral capsid antigen test. And that's not going to give us enough when it's just looking at the IgM, because all that tells us is if this is your first time having it. Now, I do see in cases where we have things that are chronically impacting or suppressing the immune system, where IgM can stay longer than normal, be positive. And that does happen, but it's a little bit less common. So we are going to test in a complete Epstein-Barr virus panel your viral capsid antigen IgM, or VCA IgM. What's next? We want to look at the VC viral capsid antigen IgG. Your IgG is your body's soldier cells that come in after the initial response to help support your immune system and make sure we clear out that infection. These ones can be positive for longer periods of time, and we'll talk about this in a little bit. So we want to test viral capsid antigen IgG. We also want to test nuclear antigen IgG. This is the inside part of the virus that your immune system responded to. So we have VCA IgM, VCA IgG, and a nuclear antigen IgG. The other part that makes this panel complete is your early antigen IgG. And this is commonly what is positive when we first have a reactivation. It usually stays positive for about 6 months during a reactivation. This is helpful because if we see that positive, we know, okay, you've had this before and you have a reactivation. Now, It can be tricky though, because what happens if you're still having symptoms and we're past that 6-month mark where typically the early antigen IgG also goes back down. And we'll talk about that. Other labs that you want to consider, make sure that your doctor is also checking a CBC and a CMP. If you have low white blood cells, WBCs on your CBC, it can tell us that this has been a chronic infection that your body has been dealing with. And as far as your CMP, we always want to check in on your liver and kidney function and how everything is functioning, as chronic infections can put a burden on your liver. So that's the standard panel for Epstein-Barr virus, and then your standard labs that you want to make sure that you have. Now, what does this all mean? Because oftentimes your IgM is negative, your early antigen is negative, but that viral capsid antigen IgG and nuclear antigen IgG are elevated and you don't feel well. You're fatigued, you have brain fog, you have flare-ups, you might feel malaise, times where you have swollen lymph nodes, sore throat, achy, and this usually presents cyclically. What does it mean? Oftentimes conventional medicine will say that just means that you had EBV in the past and that it's no longer bothering you. But that's not how our body always works. It's not always this cookie cutter, labs do this and then they do this. So when your IgGs are really high, a lot of times I see them where the lab will say greater than this upper limit of normal. And it's so high, it's greater than 600 or something, where the lab can no longer read it because it's so high. And when that is happening, or I typically say if you're greater than 10 times the upper limit of those IgGs and you have a lot of symptoms, then we want to address that viral load and get you feeling better. Now, another question that I commonly get about EBV labs is, well, how long after I do treatment does it take for these labs to normalize? And how will I know if it's possible that the IgGs, because they are an example of responding to a past infection, if they're always going to stay positive? And this can be very tricky. Typically, we go by how you are feeling. It takes a long time for the body's actual way that it's presenting with Epstein-Barr virus and those IgGs to change. And sometimes they don't change very much. It might be a minor change and you feeling a lot better that tells us that we're headed in the right direction. Oftentimes I'll see patients who have they've gotten extensive treatment. They might have gotten high dose IV vitamin C for EBV, and then they're feeling better and they want to check their labs a week later and see that they got it, they're in the clear. Typically, it does not work that way. Usually, this is going to take longer than just a week of treatment. And if you check your labs only a week after, we're typically not going to see any difference. And so that to me is a waste of resources. We will start to see things like your CBC white blood cell count improve and not be chronically low. If we had any stress on your liver, we'll see those liver enzymes start to improve. Other labs that we might see improve and that are also on the list to consider, given how associated Epstein-Barr virus is with things like Hashimoto's, as we might see improvements in your thyroid levels, other labs like that. Sometimes I often also look at oxidative stress levels and things like that, and we'll see those things improve, showing us that your body is no longer struggling so much from a chronic viral load. However, those antibodies to that virus, based on your immune system and how it responds, that can take a lot longer to have major changes. And it could be that we still see those IgGs elevated for longer periods of time because that's part of our body's immune response. I hope that this has been helpful for you in understanding your Epstein-Barr virus labs. If this was helpful, then be sure to subscribe and check out our upcoming episodes that will dive deeper into Epstein-Barr virus. Be well.